Mental Health Care of the Elderly and Long-Term Care, Martine Senatus and Janelle Rivas Gibson. By the year 2050, the elderly population is expected to rise to 2 billion. The number of elderly in long-term care with mental health illness is rapidly increasing. The most common mental health diagnoses are Alzheimer's, dementia, and depression. Our literature review produced 60,000 articles. The topic of concerns varied from quality of life, concerns of living in long-term care, and therapeutic interventions. The CRAP test was used to evaluate the studies. The quality of life and mental illness is significantly impacted by the level of care and evidence-based therapeutic interventions. There's a positive relationship between activity involvement, positive affect, and social relations. The article used was from Lee, Proctor, Morrow, Hashi, 2013. Our critical analysis of the literature showed screening alone does not fill in the gap for identification and provision of care for mentally ill elderly. The organizational infrastructure support is also required. Policy reform and system changes are needed. The inclusion of marriage and family therapists in long-term care settings are required. Lack of care provision can lead to decreased quality of life, which affects ADL's ability to complete activities of daily living. We also need skills training of staff. The critical analysis also showed depression leads to decreased quality of life. Mental health assessments with referrals to services are necessary. Addressing the lack of psychiatric staff must also be done. Reducing excessive use of psychoactive drugs is another point. Complementary alternative therapies can be utilized. Continuous training of staff must occur. Differences of opinion between staff and residents about resident needs must be explored. Our interventions need to target our clinical expertise, our evidence-based practice guidelines, patient values, and the best research evidence. These will all help with psychosocial rehab, skills training, behavioral training, and complementary alternative therapies. In order for this to occur, policy-level changes are needed. The role of the DNP is to improve healthcare outcomes through organizational system leadership for quality improvement and systems thinking. There also needs to be an integration of healthcare policies, practice management, and practical strategies to improve quality of care. In conclusion, evidence-based, cost-effective care of the elderly is possible. It can be done through education and organizational policy change. Please note the references used for this PowerPoint, our second page of references, our final page of references.